Alert 9. Odors that indicate the presence of cancer in your body. Did you know that your body may be trying to silently alert you to a serious problem? Have you ever felt a strange smell coming from yourself and couldn't explain why? What if I told you that certain body odors can be early signs of cancer? Yes, as unusual as it may seem, scientific studies show that our body can release specific chemical compounds when something is wrong, including when tumors are developing. What can these smells reveal about your health? This information can be the difference between an early diagnosis and a late treatment. Throughout this video, you'll discover 9 unusual odors that research shows may be linked to different types of cancer. Recognizing these signs can be a vital step in saving your life, or that of someone you love. Let's get started. 1. The acidic smell that escapes your body and can reveal a cancer hidden in the intestine. Imagine your intestine as a true forest of bacteria where everything works in harmony to ensure the digestion of food and the health of the body. Now, imagine that something begins to destabilize this ecosystem silently. This is exactly what can happen when cancer begins to form in the intestine. This transformation can generate profound chemical changes in the inner workings of the body, resulting in unusual odors that manifest themselves on a daily basis, often before any other more obvious symptoms. One of the most frequent signs reported by experts is a change in the odor of the stool. They can give off a more acidic, strong, and persistent smell than usual, caused by the buildup of compounds such as hydrogen sulfide, known for its odor similar to that of rotten eggs. This gas is naturally produced during digestion, but its concentration increases when the intestinal balance is disrupted by a tumor. In addition, bloody stools, even in small amounts, can emit a characteristic metallic odor, similar to iron. This smell is the result of blood oxidation, a sign that often goes unnoticed, but which should be taken seriously. Another common manifestation is intestinal gas, which can also acquire a more penetrating and abnormal odor. This is because cancer can cause a partial obstruction in the intestine, leading to the accumulation of waste and toxins that ferment and release even more intense odors. In more advanced cases, even the breath can be affected. Some people report a smell in the exhaled air similar to rotting food or unpleasant chemical compounds. This odor arises when the toxic byproducts of digestion, prevented from being properly eliminated, are absorbed into the blood and released through the lungs. These changes can be mistaken for common digestive problems such as food intolerance or poor digestion, but they should not be ignored. If you are over 50 years old, are in a risk group, or notice these persistent odors, especially accompanied by weight loss, tiredness, or changes in intestinal rhythm, it is essential to seek medical advice. Ignoring this alert from your body can be costly. Sometimes it is in the subtlest detail that the key to an early diagnosis and, consequently, to a cure is hidden. 2. Sweet breath like rotten fruit. This discreet sign can indicate liver cancer. The liver is one of the quietest and, at the same time, most vital organs in the human body. It filters toxins, metabolizes nutrients, and helps maintain the body's chemical balance. But when something doesn't go well with the liver, it can also send unexpected signals, and among them, the smell you give off. One of the most intriguing odors reported by doctors and liver cancer patients is a sweet breath, often compared to the smell of rotting fruit or even ammonia. This phenomenon occurs because the diseased liver loses the ability to properly metabolize certain toxic substances. When these toxins accumulate, they escape through the breath, turning breath into a chemical warning sign. This smell can persist even after brushing your teeth or using mouthwashes, which makes it even more concerning. In addition, high levels of bilirubin in the blood, common in people with liver cancer, can contribute to a more intense and strange odor on the skin and sweat. This different body smell can be described as acidic or mildly chemical, and it tends to intensify as liver function deteriorates. Another subtle clue is sweat, which can gain an unusual odor even in situations of proper hygiene. This happens because the liver also influences the breakdown of proteins and fats, and when this process fails, volatile compounds are produced and released by the skin. In people with jaundice, that yellowish color in the eyes and skin, these signs are usually even more evident. But unfortunately, they are often attributed to other minor problems, such as stress or poor diet. That's exactly where the danger lies. Ignoring changes in body smell can mean missing out on a valuable opportunity for early diagnosis. If, in addition to these odors, you experience symptoms such as constant fatigue, pain in the upper right part of the abdomen, loss of appetite or abdominal bloating, immediately seek a health professional. Liver cancer can progress quickly, but when detected in the early stages, the chances of successful treatment increase significantly. Pay attention to the invisible signals that your body emits. They may seem strange, but they're there for a reason: to protect you. 3. When your breath gives away a danger, strange odors escaping from the lungs. Breathing is so automatic that we rarely stop to think about the air we exhale. But what if your breath starts to smell strange, acidic, or even putrid for no apparent reason? In some cases, this may be one of the first signs that something serious is happening in your lungs. Patients with lung cancer, especially in more advanced stages, often report changes in their breath odor. This smell can be described as chemical, similar to solvents or even decaying meat. This happens because the tumor can produce volatile organic compounds, substances that accumulate in the lungs and are released along with the exhaled air. These compounds not only affect breath, but also carry important information about the inner workings of the body. When the lungs are compromised, the ability to filter impurities and oxygenate the blood decreases, which can favor the accumulation of toxins and alter the composition of the air that comes out of the mouth. In addition, secondary infections are common in cases of lung cancer, and they can also generate strong and unpleasant odors. Bacteria that proliferate in injured areas of the lung release gases such as hydrogen sulfide, known for its sulfur-like smell or rotten egg. This type of persistent breath, which does not improve with oral hygiene, should be considered a warning sign. Another important detail is that these odors can be accompanied by symptoms such as chronic cough, chest pain, hoarseness, or shortness of breath. In many cases, people attribute these signs to smoking, tiredness, or recurrent flu, delaying diagnosis. And the more time is lost, the more aggressive the advance of the disease can become. If you are a smoker, former smoker, or have a history of exposure to toxic substances, the risk is even greater. Paying attention to the smell of your own breath may seem strange, but it can be an essential step in detecting cancer at an early stage. And if your breath has changed persistently, seek medical evaluation. It could be just a passing problem, or it could be your body desperately trying to tell you it needs help. 4. The sweet and metallic smell that no one links to cancer, but it could be leukemia. Leukemia is a type of cancer that directly affects the blood and bone marrow. As it interferes with the body's defense system and the production of blood cells, its manifestations can be more subtle, but very dangerous. Among them is a little-known sign, but which can be decisive: changes in the smell of breath and even sweat. Patients with leukemia, especially in later stages, may have a sweet metallic odor, described as something different from anything they have ever experienced. This peculiar smell is a consequence of the accumulation of toxins in the blood, as the body loses part of its ability to filter and eliminate metabolic waste. One of the main culprits for this odor is uric acid, which rises significantly in many cases of leukemia. When it builds up, it can cause a slightly sour, sweet, or metallic smell, noticeable especially on your breath. Another important factor is anemia, a condition almost always present in cases of leukemia. Fewer red blood cells available, there is a greater degradation of hemoglobin, a process that can intensify this characteristic metallic odor, often compared to the smell of iron or fresh blood. In addition, as immunity is compromised, oral and gum infections become more frequent. These infections release sulfurous compounds, which leave the breath with a foul smell, similar to that of decaying flesh. Even in people who maintain good oral hygiene, this odor can persist, becoming a sign that something more serious may be going on. Changes in protein metabolism also contribute to the emergence of ketones, chemicals with a sweet and acidic smell, often confused with the breath of people with uncontrolled diabetes. These details, while subtle, are like pieces of a puzzle that the body tries to piece together to reveal an internal imbalance. If, in addition to these smells, you or someone close to you has extreme tiredness, frequent fevers, unexplained purple spots, or unexpected bleeding, don't ignore it. Leukemia can develop quickly, and time is a determining factor for the success of treatment. Observing what appears to be just a strange smell can actually be the first step to saving a life. 5. Bad breath that won't go away. It may be hiding a cancer in the mouth. Everyone has had bad breath at some point, whether after a bad night's sleep, after eating something very seasoned, or even due to carelessness in oral hygiene. But what about when this bad smell persists, even after brushing your teeth, using mouthwash, or visiting the dentist? It can be more than a common problem. It can be a sign of mouth cancer. This type of cancer usually develops slowly, and in the early stages it may not cause any visible pain or discomfort. Therefore, the most discreet signs, such as persistent bad breath, become valuable clues for early detection. The characteristic odor associated with mouth cancer is described as foul-smelling, similar to the smell of decaying flesh. This is because the tumor interferes with healthy tissues, causing necrosis, which is cell death, and inflammation. These deep lesions become an ideal environment for bacteria to proliferate, which release extremely unpleasant sulfurous compounds. These compounds remain in the mouth even after cleaning, as they are released directly by the affected tissues or by local infections caused by the presence of the tumor. Another factor that contributes to the smell is bleeding in the region. Oral tumors, especially in the gums, tongue, or inner cheeks, can cause constant bleeding. Iron in the blood, when oxidizing, emits a distinct metallic smell, which some people describe as chemical or strange. In addition, mouth sores that do not heal or that worsen over time should raise an immediate alert. If these lesions are accompanied by a bad smell and a feeling of something stuck in the throat, attention should be redoubled. Often, this type of cancer is confused with canker sores, infections, or even simple dental problems. That's why paying attention to details like breath odor can make all the difference. Mouth cancer is more common in people who smoke, consume alcohol in excess, or have HPV virus infections. But it can affect anyone, and its silent evolution makes early diagnosis even more essential. If bad breath has become a constant companion, even with all the hygiene care, don't ignore it. It could be your body crying out for help, and you have a chance to hear that call in time. 6. Change in female intimate smell. Know when this may indicate ovarian cancer. Changes in intimate odor are something that many women have experienced at some point in their lives. In most cases, these changes are related to the menstrual cycle, diet, or small, easily treatable infections. But in some cases, these changes can indicate something more serious, such as ovarian cancer. This type of cancer is known as the silent killer, precisely because it usually evolves without obvious symptoms until it reaches more advanced stages. However, some subtle signs can appear much earlier, and among them is the modification of the odor of the intimate region. Women with ovarian cancer may perceive a different persistent smell that does not disappear with hygiene and that deviates from their natural pattern. This odor can be described as slightly sweet, sour, or even metallic, depending on the stage of the disease and the chemical changes in the body. The explanation lies in the hormonal imbalance and changes in cellular metabolism caused by the tumor. When there is ovarian cancer, the vaginal flora and the acid-base balance of the intimate region can be affected. This favors the proliferation of opportunistic bacteria, which generate volatile compounds responsible for unusual odors. In addition, the presence of abnormal secretions, especially if accompanied by blood or different color, can intensify this smell and should be investigated urgently. It is important to remember that ovarian cancer, although it does not directly affect the vaginal region, can affect the functioning of neighboring organs and cause inflammation and secondary infections, which also influences odor. Another worrying factor is that, out of shame or believing that it is something temporary, many women fail to report these changes to the gynecologist. This omission can delay diagnosis and seriously compromise the chances of successful treatment. If, in addition to the unusual odor, you notice symptoms such as pelvic pain, abdominal bloating, frequent need to urinate, changes in the menstrual cycle, or discomfort during sexual intercourse, seek medical help immediately. Studies show that when detected early, ovarian cancer has much higher cure rates. Therefore, listening to your body, even in the most subtle messages, can be an act of self-love and a saving attitude. Do not ignore the intimate signs that insist on remaining. They may be saying more than you realize. 7. Smelly skin wounds. This can be much more than inflammation. The skin is the largest organ in the human body, and therefore it is also one of the ones that most communicates with the environment and our internal health. A simple wound that does not heal may seem harmless at first glance, but if it is accompanied by a persistent bad smell, it can be a sign of something much more serious: skin cancer. This type of cancer, despite often being visible, can go unnoticed when the signs are not associated with a higher risk. Wounds that do not heal, bleed easily, or change appearance should always be investigated. And when these wounds start to give off an unpleasant, foul-smelling odor similar to rotting flesh or decaying tissue, the warning needs to be even stronger. This odor is caused by the process of tissue necrosis, that is, by the death of skin cells, added to the proliferation of bacteria that feed on these dead tissues. These bacteria release compounds such as amines and sulfur, generating a very characteristic smell. Even with proper hygiene, this odor can persist as it is being generated from within the lesion itself and not just on the surface. In many cases, people ignore this symptom thinking that it is only a mild infection or an allergy. But when we talk about skin cancer, especially the type called squamous cell carcinoma or ulcerated melanoma, the foul smell may indicate that the tumor is already at a more advanced and aggressive stage. Another worrying factor is when the smell is accompanied by purulent or bloody secretions. These secretions, in addition to causing bad odor, are an indication that there is tissue degradation and possible secondary infection. The wound site can also emit heat, pain, and have excessive redness, aggravating the condition. Being aware of these signs is essential, especially for fair-skinned people who have had prolonged exposure to the sun without protection or a family history of the disease. Early diagnosis is key to increasing the chances of cure, and recognizing an unusual smell can be the first step on that journey. If you notice a sore with these characteristics which does not improve over time and begins to give off abnormal odors, see a dermatologist immediately. The skin speaks, and sometimes it screams. 8. Ammonia-smelling sweat. A silent sign that your kidneys may be at risk. Sweating is one of the most natural ways the body uses to regulate temperature and eliminate toxins. But sometimes, what should be just a physiological process can carry a deeper message. When sweat starts to smell strong, similar to ammonia or urine, It can be a worrying sign that your kidneys aren't working as they should, and in more severe cases, it can indicate kidney cancer. The kidneys are responsible for filtering the blood and eliminating waste through urine. When there is a tumor compromising this function, the accumulation of toxins in the body increases dramatically. One of these toxins is urea, which at high levels can also begin to be eliminated by the skin, especially by sweat. Urea, when decomposed, releases ammonia, a substance with a very characteristic and strong smell, reminiscent of cleaning products or concentrated urine. This odor does not disappear easily, even after showers and the use of deodorants, as it is coming from the inside out. In addition to the smell, sweat can also become more intense and sticky, signaling changes in metabolism caused by kidney overload. In some cases, this body odor is accompanied by other signs such as swelling in the ankles, abnormally colored urine, persistent low back pain, or unexplained fatigue. Although these symptoms can be caused by other kidney diseases, it is essential to consider the possibility of cancer, especially if the smell of ammonia in sweat is persistent and without logical explanation. Kidney cancer often develops silently, and when the signs appear, the disease may already be in more advanced stages. Therefore, recognizing subtle changes such as the smell of sweat can represent an opportunity for early diagnosis. People with a family history of kidney problems, hypertension, smoking, or prolonged use of medications should be even more attentive. Ignoring this signal is like silencing an important alarm. If your body is giving off different odors and you feel that something is not right, see a doctor and ask for specific tests to assess kidney function. Often the answer lies in what you feel but can't see, and acting in time can make all the difference between early discovery and the fight against a disease at an advanced stage. 9. Fermented breath. That doesn't improve with oral hygiene can be a warning of stomach cancer. Have you ever smelled a strange smell coming from your breath, even after brushing your teeth several times? A fermented odor, similar to spoiled or sour food? This type of breath change can be more than a simple digestive problem. It may be the first sign of stomach cancer. Gastric cancer, as it is called, usually develops silently. In the early stages, it rarely causes severe pain or very obvious symptoms. But the body, once again, can use odors as a way to manifest itself. When there is a tumor in the stomach, the digestive process is profoundly affected. Foods that should be broken down and absorbed correctly start to ferment for longer, generating compounds that are reabsorbed and partially eliminated by breathing. The result? A persistent, acidic, and sour breath, which does not improve with brushing or using mouthwashes. This smell can be described as something similar to spoiled milk or sourdough. It is mainly caused by the release of ketones and other byproducts of the incomplete breakdown of food in the stomach. In addition, the presence of blood in the gastrointestinal tract, something common in cases of stomach cancer, can cause a metallic odor in the breath, added to the characteristic smell of interrupted digestion. Another relevant factor is the presence of the bacterium Helicobacter pylori, often associated with ulcers and also with gastric cancer. This bacterium, when multiplying, can generate sulfur compounds that further intensify bad breath. Stomach cancer, when identified early, has a greater chance of successful treatment. Therefore, signs such as this type of breath should be taken seriously, especially if they are accompanied by other symptoms such as burning, a feeling of fullness after small meals, frequent nausea, involuntary weight loss, or persistent tiredness. Many people believe that bad breath is always related to the mouth, but this is not always the origin. In some cases, it comes from within and reveals much deeper imbalances. Observing these changes can be uncomfortable, but it is an essential step in taking care of your health. If you smell this type of smell frequently and for no apparent cause, don't ignore it. The body has discrete ways of screaming for help, and this may be one of them. The human body is a complex, intelligent, and surprising machine. He talks to you all the time. and sometimes uses silent signals to warn of unseen dangers. Unusual odors may seem like irrelevant details, but as we've seen, they can hide urgent messages about your health. Recognizing these signs does not mean living in fear, but with awareness. Being aware of what the body communicates is a form of care, respect, and above all, self-love. And not only for you, but also for those who are by your side and care about your life. Don't hesitate to seek medical help if something seems out of the ordinary. A simple exam, a quick consultation, or a closer look can be what separates early diagnosis from a more difficult battle. Information is one of the most powerful weapons we have to beat cancer. And today, you took an important step by informing yourself. Share this knowledge, encourage others to listen to their bodies, and never underestimate the signs, no matter how small they may seem. Because sometimes, it is in detail that salvation is found. Take care of yourself, be present in your own life, and remember, the sooner we find out, the greater the chances of winning. Here's an engaging title suggestion: Utilizing Mental Triggers of Urgency, Curiosity, and Promise of Benefit.